Part two brings us to how do facilities monitor quality. And we talked about quality assurance and total quality management. Facilities monitor their quality with indicators and metrics. And a quality indicator is something of concern. In that previous example, an indicator would be catheter-acquired urinary tract infections. The metric is the measurement, which would, in this case would be the rate of catheter-acquired urinary tract infections per surgery. So that would be the metric. An indicator is what you're looking at or the problem. The metric is a measurement of the problem. So who really determines the standards and goals? Well, there's a lot of different places where standards and goals are set. The ANA has standards of nursing care. Joint Commission sets group accrediting standards. Another one, AHRQ, sets clinical practice treatments. Each hospital, clinic, school, whatever, sets their own standards of practice. And then you compare within baseline. You can compare one nurse on the med-surg floor to all the nurses on the med-surg floor. You compare nurses in Wisconsin to nurses in the U.S. And you can look at literature and published results. Those are all, and they all could be different standards of, and goals. Hopefully, they all are in line with one another. It's when they aren't, that's when the problems happen. So we can use state reports from MDS for measuring performance, and MDS is most commonly used in nursing homes. You can survey patients. Every patient gets a survey when they've been discharged. And my goodness, hospitals really pay attention to those surveys. You examine patients while they're in the hospital. You can audit medical records. You can do a concurrent, which means as it's happening, or retrospective, going backwards. So you can pull random records from 6 months ago and do a total medical record review of those. You can review reports, incident reports, infection rates, pharmacy, financial and utilization review reports, and you can do tracer methodology. Tracer methodology is very detailed. In a tracer methodology review, if let's say when I was in the hospital, they did a tracer on me. Every person that had contact with me is evaluated. Everything they've done, every documentation, so everything the nurses said, the respiratory therapy said, the physical therapy, custodial reports, housekeeping reports, doctor's reports, everything is evaluated. When I was in the hospital specifically, I had a patient I had one of the vice presidents of the hospital come down and just give a quick evaluation survey of what I was experiencing. This was day 2, so I was really heavily medicated when he talked to me at that point. But hospitals in particular are really focusing on good outcomes. The quality control department, QA department, always receives data and analyzes trends, and it compares what's happening with what are the standards, and it recommends actions. And if the current results are acceptable, it may recommend steps to even improve. Nobody is ever satisfied with good enough. They always want a little bit better. That can be really frustrating as nurses. We're doing good. Now we got to do better. And that's hard. So is the results acceptable? If it is, then we continue, but more likely we are going to look for better and tighter controls. If it's not, we have to look for why the results are not acceptable. Was it a fluke? A one-time event? And I can't think of an example of that. But that happens. Flukes happen. And that doesn't usually require a change in process. But if there's an ongoing problem, you have to look for, is there a system problem or a root cause that is triggering all these? So we look at Six Sigma as a way of improving efficiency and capability. Now I remember I said Six Sigma comes right out of Toyota. They created the whole Six Sigma protocol. And the goal is to reduce errors, bottom line. The goal is to increase profits by reducing errors and decreasing misuse of systems. So they always want to improve processes that fall below goal or norms. We use the DMAIC, define, measure, analyze, improve, and control steps in improving toward better processes. The goal is to get near zero defects. And it assumes that the process that is happening is the correct thing to do. That's the assumption, that what we're doing is correct. Six Sigma does not walk into a situation saying whatever's going on is wrong. They assume whatever's going on is right. But what they're looking for are righter or better ways of doing it. Six Sigma is complex. We're not going to get into any deeper than this. If any of you have been through a Six Sigma event in your facility, you understand how much of a detailed dig they go at everything, and usually they get the results. That's the end of part 2.